Sure.
Dr. Pai from Bloom IVF, thank you so much for joining us today. I think it's fair to say that you're a legend in the IVF industry. Am I correct?
I would not say, I mean, that's for the others to say. I would say that I started doing, I got my fellowship in 1989-90. I went to Melbourne to Professor Ian Johnston's unit in the Royal Women's Hospital. And he has the privilege of having the world's second IVF baby.
Wow.
And, at present, they are taken over by the Virtus Corporation. So I was there for a year's time and I came back in 1990 and I started IVF in India. Since the last 30 years, I'm doing it. So it's been a lot of evolution, things have changed so much. I've had the privilege and pleasure of seeing the evolution in the field of IVF.
Yes.
How we have grown in.
I was just going to, sorry to interrupt you, I was going to say, you've pioneered so many incredible techniques in India, haven't you?
Yeah, it's been my, obsession of pioneering all new techniques all the time. In India, it's very difficult to invent a technique. You need to apply a technique because invention entails a lot of investment in terms of time, energy, cost, which is very difficult. Now, the new India is changing. Now, more and more research is being taken place. But the main research in those days and even now, a lot of pioneering research is done in United Kingdom.
Yes, yes.
I think UK is the hub of knowledge, and majority of inventions in medicine have come from UK.
Well, I have to say, it's thanks to brilliant people and brilliant minds like yourself that I am now the proud mummy of IVF twins. My twins are 10. And like I said, had it not been for geniuses like yourself who are pioneering these incredible techniques, then I wouldn't be a mother today. So thank you.
Right. Thank you. Thank you for that.
So whilst I've got you, I'm very, very keen to ask you just some very, very straightforward questions about the basics. So for anybody that is trying to get pregnant and they just don't know what to do, I'd love to just go through some of the stages with you. So let's take, for example, a couple in their early 30s and they've been trying to get pregnant for a year and it's just not happening. What should they do?
So it's important that we need to give at least 1 to 2 years to nature. However, even though you're getting married, you can always nowadays do some minor investigations like a semen analysis, which will give you an idea whether the guy is okay or not. And as far as the lady is concerned, a simple anti-Mullerian hormone test, which will tell you about your ovarian reserve, and an ultrasound. I think these 3 tests would more or less give you an overall general idea whether everything is okay with you or not, the couple. Once that is done, so normally I would tell them that they should wait for 1 to 2 years. If you are an older person, more than 35, then yes, within 6 months, 6 months to a year, you need to start trying. If you are a younger person, maybe 2 years would be also a good time to just give it to nature. But these small tests you can do just to rule out any major problem.
Yes. So those tests for the woman, it will test if she's got, like, how many eggs she's got left.
Right.
And
right. So the anti-Mullerian hormone is a very important test. And the normal range is 2 to 3.5 nanograms per ml. If she is less than 1.5, or it's most probably a poor reserve. And these are the women, they should try for a pregnancy earlier. And if it is more than 3.54, most of the PCOS women have a higher AMH level.
Yes.
So by that, you can, because the whole operational part of IVF is dependent on the number of eggs, as far as the woman is concerned. And as far as the man is concerned, it is the semen test, which is very simple to do. A semen analysis will give you a general idea the guy, whether he has a problem or not.
Yes. And what happens though if the test results come back and your AMH looks fine and there's not an issue with the male? What do you do then?
then you have a good time. Take your time,
Yes.
and naturally you may become pregnant in a year's time or so. You can track your ovulation a bit, try to have sex during the time of ovulation. There are a
Yes.
lot of apps available now on the net where you can track your cycle, ovulation, etc. You can go to a consultant also and track your ovulation on ultrasound. In India we do that quite a lot,
Yes.
because ultrasound is easily available. So you can see whether how the follicle is growing. And when it ruptures, you can have what is known as timed intercourse, TI it is called.
Mhm.
So with that, many people achieve pregnancy in 6 months to a year's time. If that fails, then you start becoming more aggressive in your investigations and therapy.
And so, who, when it comes to IUI and IVF and ICSI, who is that for? What is sort of going on in your body that you would need to have such kind of treatment?
Right. So now, once you do the natural, many of the couples, they'll achieve pregnancy. So if 10 people get married and they do this naturally, around 8 or 9 couples will achieve pregnancy in a year's time.
Wow.
If everything is after a year, one of them or two of the couples will still do not achieve pregnancy. That we would then investigate them more aggressively.
Yes.
And normally in the woman we would like to do an ultrasound, some hormone test to rule out a thyroid or a diabetes, or you know obesity also is a big contributor to IVF. Look at the BMI. And in the male you would look at a semen sample. If it is low, you would treat the male. And with that, we would also look for whether the tubes are open or not. So tubal patency is nowadays done by, in the olden days, it used to be done by an X-ray of the womb. It was called hysterosalpingography.
Mhm.
And even now, many people are using a lipoid dye and using that to do the HSG. And apparently with the lipid-based dye, the pregnancy rates are also increased
I
in
see.
women. So you not only do a test to find out whether tubes are open or not, but that dye itself can increase your chances of pregnancy. In
Wow.
fact, when I had gone to Shanghai 2 years back, there's this guy who does only X-ray of the womb, and apparently he's so famous all over China. People come to him to do this dye test, which apparently is a magic test which gives a lot of pregnancies.
What on
So in
earth
the
is going on in that test that it could lead to a pregnancy?
So, yeah, because there's a lipid, it's a lipid-based dye. I can't take the name because the company is there,
Yes.
but it's a lipid-based dye, oil-based dye. It's a oil-based dye. The newer dye that we use for testing is a water-based dye.
Yes.
So the olden times we used to use the oil-based dye, but we were a bit scared that it would stay in the tube, and also we stopped using it and switched it over to the water-based dye. But the oil-based dye apparently used to increase the pregnancy rate in the women. And there are a lot of studies that have shown recently that this dye not only helps us to find out whether tubes are open or not, but it also increases the pregnancy rate.
Wow. Okay. So
So,
these tests then that will check, I suppose, for blockages to see the kind of
right,
structure, to see if there are any
right.
structural things that
So
are.
most of the time, in let's say 80% of the patients, the tubes are open. There's nothing gross. Ultrasound doesn't show any fibroids, adenomasses. There's no adnexal problem. There's no endometriosis. In these patients, we can then go for an IUI. So
Yeah.
IUI is called Intrauterine Insemination. It's an acronym. Short form is IUI.
Mhm.
And with the IUI, what we do is we give them some mild medicines and then track the follicle. When the ovulation ruptures, then we take the husband sample, process it, and the best quality sperms are inserted in the uterine cavity at the
Yeah.
time of ovulation. And with this, 10 to 15% people achieve pregnancy every time. So if we do, let's say 10 people undergo IUI uh, 3 times over 6 months time period, out
Mhm.
of these 10, nearly 5, 6 will become pregnant with IUI.
Right. Okay. Yes.
So remember, out of the 10 couple who get married, 8 or 9 will become pregnant naturally. Out of the remaining 2 which will not become pregnant, if you do IUI on them and a little bit of ovulation induction, 50% of them will become pregnant. And the remaining ones are the ones who will need IVF.
Okay. Okay, so
So
IUI then is for a woman who doesn't have any blockages and a man who has good enough
a
quality
good
sperm.
sperm, yeah. So like a sperm count of, let's say, post-wash, after processing of more than 5 million motile would go for an IUI sample. If the post-wash sperm count is very low, 2 million, 3 million, then the chances of pregnancy with IUI are less. And most of them have male factor infertility. They will go for IVF or ICSI.
And so would it be possible for a man to improve his sperm quality? So say for example he is about to do IUI or has failed an IUI, could he then improve the quality of his sperm before he then goes for another IUI? Is there something that he can be doing?
Yeah, yeah. So when we look at the man, suppose his count is low, we look at to rule out causes of male infertility. They may have a infection, he may be obese, he may be smoking, he may have alcohol, his diet may not be good, he may have stress, he may have a varicocele, which is a swelling of the vessels around the testes. He may have, so all these hormonal disturbances. So all these are corrected. Most of the time, there is no cause. It's called idiopathic male infertility. Counts are lower, motility is lower, and many of these people, we are giving empirical treatment using either some medicines like clomiphene, or we can also give them, supplements. There are a lot of supplements that have come in the market, and with that supplement, there is some very low evidence saying that these supplement may work. So we give them all that, and some of them, their counts get increased, their motility become better, and they become pregnant with this.
Yes.
So before we go for IVF, we would improve their count.
Yeah.
If the count is less, improve their motility, and then do the IUI. If there's a varicocele, we would correct it by surgery.
Yes. Yeah.
But it has to be a palpable varicocele. Means it has to be clinically felt on the hand. Yes. Many of the times varicoceles can be picked up on ultrasound, but Doppler. But they are not, many people try to operate on them. Only those varicoceles which are palpable should be operated.
Yes. And I think what you were just saying there about, taking supplements, watching your weight, not drinking so much alcohol and smoking cigarettes. Because when I look back at my own journey, I wish me and my husband had done a lot more for our own lifestyles, because who knows, maybe we would have got pregnant through IUI or naturally, but instead we had to do IVF and ICSI. And actually it wasn't until I got into IVF that I started hearing about all the things that I could do for myself that could enhance perhaps the chances of a successful pregnancy.
Right. So I totally agree with you. And Mediterranean diet is very important.
Yes.
So I always say that everything that is like not that tasty is healthy. Unfortunately. But what has happened is that in our childhood, we were not, attuned to the taste. So I would request all the mothers in the future that they need to educate, or they need to modify the taste of the child. Yes. When he's a young person. So you must make them enjoy the Mediterranean diet. You must make them enjoy the diet which is less with sugar and salt and oil, right from the beginning.
Yes.
Then all of us will live for 100 years.
I love that. If a patient comes to you and they have a high BMI, do you put them onto a healthy eating plan, or like how does that?
Yeah, but like I always feel that it's very, like I'm a doctor, it's very difficult for me to reduce their weight, and it is very difficult for them also. I can tell them, okay, do diet, do exercise, but it doesn't work that way. You need someone to help you to reduce the weight. You have to go to a weight loss specialist.
Yes.
It's very important. And do you know that even a 10% reduction in weight can increase your pregnancy rate by 10%. So when you counsel these patients, suppose they have a 84 kilogram weight, you have to just say, okay, you have to just reduce it by 5%, 4 or 5 kilos. But you don't have to do it immediately. Do it over 5 months.
Yes.
So 1 kilo per month. Yes. That is more acceptable to them. Otherwise, they get intimidated, the patients.
Yes.
But if you tell them, you have to reduce 1 kilo per month, they will do it.
Yes, yeah, absolutely. Because what is weight? Why would weight stop you from getting pregnant though? What is it
Because
about?
because there's a lot of hormonal imbalances that the adipose tissue causes, which can cause anovulation. There's a lot of, it can cause implantation problems as well. So ideal BMI would be 18 to 25. Of course, 18 to 24, 25 is a very difficult. But
Yeah,
anything less than 29 BMI is okay. BMI is BMI is basal body mass index,
yes,
weight in kilogram divided by height in meters square. There are
yeah,
a lot of apps which you can go on the net and you can punch and you'll get your BMI.
yes.
So your BMI should be less than 25. Then
Okay.
you are rocking.
Yeah.
Many of you are pregnant on your own. You don't need Dr. Pi or any one of us. So like if you see in England also, there are a lot of non-IVF clinics where they do weight loss, they'll do stress, acupuncture. What is that? It is just de-stressing yourself.
Yes.
Acupuncture is not really helping you, it's just de-stressing yourself. Yoga, whatever, exercises, mindfulness, holistic thought process. This is all contributing towards your better lifestyle, as I told you,
Yeah.
increasing your longevity as well.
Yes. Yeah. Absolutely. I think one thing I learned is that when you're going through fertility treatment, you're handing your body over to your doctor, and so it's very easy to feel like you've lost control as a woman as well. And so when I did take control of my nutrition and my mental well-being, and I did acupuncture, I felt like I was in control of my body. And so mentally, I don't know. I don't know if I made my body more receptible. I don't know, but I felt better. And on my final round of ICSI, when I nailed it, when I nailed the mindfulness and everything, it worked. Now I'm not saying those things made it work, but I felt better in myself.
No, I think what you are saying is perfectly correct. It contributes to better pregnancy rates. A good lifestyle by both the husband and the wife is very important. Weight loss, diet, exercise, decrease smoking, decrease alcohol, all these things, de-stressing yourself.
Yeah.
All these things are very important. And many people, you'll be surprised, a lot of my patients, they become pregnant first time with IVF. Second time they become pregnant on their own because now they don't have the stress. So
Yeah.
the stress is gone from their life. So they spontaneously achieve pregnancy. So
Yes.
many people out there become pregnant second time. I've had patients who have come they don't want a kid because they have too many. So from a position of not many to too many is a
Yeah.
problem with many people.
Yes. And so, okay, so we've covered IUI and IVF. Now, who the other one is ICSI. So who is ICSI for?
So in IVF, what happens is we take the eggs and we put about 50 to 100,000 sperms in the petri dish, and one of the sperms fertilizes the egg on its own. But in patients where there is a severe sperm factor, like a count of less than 2 million, or a motility which is very poor, or an abnormal morphology of less than 1% normal, in these patients, the sperm can't fertilize the oocyte on its own. So you need to pick up the sperm with a machine. It's called a micromanipulator, and you need to inject the sperm into the egg. And that is called ICSI, Intracytoplasmic Sperm Injection. It's an acronym. It's a short form
Yes.
for this long word. And that I started, the breakthrough came in 1992 from Brussels. And I started ICSI in 1995, 95, 96, when I actually went to Brussels to get trained. And it's a fantastic breakthrough in medicine.
Yeah.
But it was one of the breakthroughs where the jump occurred directly from the clinical practice. So normally you have experiments in animals and then it is applied to humans. But ICSI was directly applied to humans.
Yes.
Fortunately for us, everything has gone well
Yeah.
with the technique.
Amazing,
Yeah.
amazing. And like I said, it's ICSI that gave me my daughters. So
yeah, so ICSI is
I
a very good technique. Because it was a major block for male factor infertility. Of course, a lot of people nowadays do ICSI for all. It's
yes.
for everyone, irrespective of the count. But actually, it has to be done only for severe male factor infertility because there are a lot of other uh, pros and cons are there. I'll not get into that at this stage. But For severe male factor infertility, ICSI is the answer. For infertility, which is between with a count of between, let's say, 5 million to 10 million, IVF is the answer. For a count of more than 10 million, IUI is the answer.
Wow. Oh my gosh, it's incredible. It's absolutely incredible. There are so many there's so many things I want to ask you, but I know we've got to keep it nice and short.
Yeah.
Because you're a super busy man. But one thing I did want to just ask you about is, because we get so many emails from couples who just can't get pregnant because of the woman's eggs. So donor eggs is the only option for them. And I know a lot of couples really, really struggle coming to terms with the fact that they have to use a donor egg. Can I just ask, in India, what sorts of percentage of couples going through IVF need to use donor eggs? Is it common?
So no, I have found that as the, in the newer generation, a lot of people have got low AMH levels now. So the ovarian reserves are quite low in many patients. Nearly 20% of them are poor responders. So we classify patients based on AMH level and antral follicle count level. Yes. That is the amount of follicles between 2 and 9 millimeter on second day of your cycle on ultrasound examination. And so if the AMH is less than 1.2 with the AFC of less than 7, we call it a poor responder. And the AMH of 2 to 3.5, AFC between 8 and 15, we call it a normal responder. And AMH more than 4, which is a PCOS normally, with the AFC of more than 20 is called a hyper responder. So we don't have any issues with normal and hyper responder because we get a lot of eggs and we get a lot of embryos and they normally become pregnant in 3 attempts. Majority of them will become pregnant. 95% people will achieve pregnancy if she's a normal responder or a hyper responder. The challenge is with the poor responder. But what I've seen is that a lot of people are jumping to egg donation, which they should not, because a lot of these poor responders can achieve pregnancy with their own eggs. Okay, and we have got now a lot of new techniques that are coming in, which will become better and better. And I would predict that within 10 years, there will be no poor responder because already the technology has come where we can make eggs out of skin cells. And in mice, it is already been done and babies have been born. It's called pups. Mice babies are called pups and babies have been already born with the derived sperm derived from skin cells and oocyte derived from skin cells. And this technology will come into human application, according to me, within 10 years time from now. So you will be able to just take a biopsy and convert it into oocytes. So now, for the time being, there are certain experimental techniques which are okay. So what we do in a very poor responder, we'll rule out a cause. So there may be endometriosis, there may be infection. In India, we have a lot of tuberculosis. There may be a thyroid problem. Thyroid antibodies can damage the oocyte. There may be a chromosome disorder like a Turner's mosaic syndrome, or there may be what is known as fragile X syndrome. Fragile X syndrome can also manifest as a poor responder. So if you're a poor AMH level, we must rule out these conditions. Yes. It's very important. Otherwise, if there's a fragile X syndrome, she's a poor responder, you may transmit that disease to your child and she may come in with a cognitive disorder or a learning deficit. Nowadays, we don't call them mentally retarded. That's not a appropriate language. So we call them, they have cognitive disorders or a learning deficit. So we need to pick up this fragile X right there. Now, once we do that with multiple stimulations, we can collect embryos and we can freeze them. It is called embryo pooling. And then we can transfer them. And when we transfer them, we can do genetic analysis because many of these embryos may be genetically abnormal. And we can transfer a genetically normal blastocyst. So many of these patients are becoming pregnant with their own eggs, but they need multiple cycles. And that is why it is very important to do your AMH right at the beginning. If your AMH is low, or if you are not getting married before the age of 35, you can freeze your oocytes.
Yes.
Absolutely. I've been freezing oocytes in 2007. I was the first in India to start oocyte freezing in 2007. And one of her Miss World, I will not mention her, she came to me when she was not married and she had an endometriosis. I froze her eggs and after 9 years, she had 3 children with frozen eggs.
Oh my God.
But she was very intelligent. you can't become a Miss World without being in
Yes.
lack of intelligence. They are
Yeah.
good looking, but very intelligent women.
Yeah.
And she froze her eggs at a time. I just come from Tokyo with a technique, and she came and to me, and she even came inside the lab. I remember after she got her eggs out, she came and said, "Doctor, can you show me how you freeze the egg?" In those good old days, I used to do the freezing myself. Now, of course, there are embryologists who do it. But
Oh,
so this is one way to beat that poor response. Freeze your eggs beforehand. But if you come to me with a poor response, I would never advocate donor eggs. Donor egg is the last resort.
yes.
I was trained by Howard Jones, who was the first to have the IVF baby in United States. He died at the ripe old age of 100, I think.
Oh,
And he said that there are three things people don't like. This was one of the best lectures I've heard before he died, 2-3 years before, at the American Society of Reproductive Medicine meeting. He had a beautiful lecture. We used to have a breakfast meeting. He said they don't like a donor egg, they don't like donor sperm, and they don't like a donor womb. So he said the future will be when you replace the donor egg with their own egg, replace the sperm with your own sperm, and replace the womb with the artificial womb. It is known as exogenesis. Aldous Huxley wrote about it many years back, that you can create a child totally outside the body with an artificial womb. And this will become a reality maybe 20 to 30 years from now.
wow.
You'll be able to do the entire child can be like in a semi incubator. But as I told you, oocyte and sperm, we are already onto it. We have already done it in mice. So it's just a matter of time before we do it in humans.
Do you know, I
So
just,
donor egg, I never advocate to my patients. I always tell them try, and if not, then of course donor egg is a last resort. But
yes,
a lot of them, you can even do PRP injections, stem cells. They are all experimental. But
yeah,
some of them do become pregnant, and women want their egg. They don't like. If I tell someone that you do donor egg, they get really upset.
yes. You know, talking to you today, one thing that really, really comes across when talking to you is the feeling of hope, and you take away that feeling of panic as well. So I've just learned from you today that, don't jump to conclusions, because a lot of people think, well, I can't get pregnant, so I'm going to have IVF, or, well, I'm going to have donor egg, or I'm going to have to do this. But what I've learned from you today is no, just take a breather, get tested correctly. There are things that you can do to help yourself, and as importantly, talk to brilliant doctors like you who can actually guide and make things happen. It's been incredible talking to you.
Thank you.
And I would absolutely, I'm very cautious of time, and I was wondering if perhaps I could steal you for another sort of half an hour another time, because there's so many things I want to talk to you about.
Yeah, there are a lot of breakthroughs that are there in this line, which people should be aware of. These
Yes,
are called add-ons, but
yes,
we can have a different talk on the add-ons.
yes.
And I know, especially patients, they have repeated failures, and they come to me from all over the world. They come to me with 8 failures, 9 failures. So that's where the add-ons really work, according to me. A lot of people, they don't accept it, but I feel that. So in the first 2-3 cycles, I never use any add-on.
Right.
However, I feel that some kind of non-intervention add-ons can be used even in the first 1-2 cycles, maybe with a proper counseling.
Yes.
So to tell them that, okay, listen, this is not definitively proved, but if you are okay with it, we'll use it. I think we should give that right of choice to the patient.
Yes.
We should not decide for the patient. I will tell you, a lot of people, they decide, okay, now you should go for donor egg. No, you should allow the patient to decide it. You need to counsel the patient. She
Yes.
should take the decision. The couple should take the decision. And many times I've come across people who have done donor sperms. And nowadays with micro TC, we can get sperms even from testes of azoospermic males, and we can give them pregnancies.
Wow.
So I always believe in what Howard Jones said.
Yeah.
I always look for the non-donor option,
Yes.
because the donor option is important. Of course, donor is important. Surrogacy option is important. Egg donation, sperm donation, but they are not the most important thing. We must keep them as a last resort.
Yes. I think so many people, well, I say so many people, the emails and messages that we've had from young people who are struggling to conceive, there's a real fear as well of, you know, of the unknown and, you know, IVF and the doctors. But you, yeah, you're incredibly comforting, and I think I'd be very, very happy to come to you. And, you know, like I said, with this incredible attitude that you have of, you know, don't rush, don't panic. And I wish they were all like you, Dr. Pai.
You know, I would like to say that, you know, they phone me and say, doctor, what's the cost of IVF? I said, what are you saying? What is your age? When are you married? Why do you need IVF? Who has told you that you need to do IVF? They are just saying, okay, I'm infertile, I want to do IVF. IVF is there only for 10% of couples.
Wow. That's an that's
Who are infertile. So I remember what I said. 10 people will get married, 9 will become pregnant, 1 of them will not become pregnant. That is the infertile couple. Of those patients, 50-60% will get pregnant on IUI. Only remaining would need IVF, or some of them will need ICSI because of the low count. So it's a very simple line. It's a very algorithmic line.
Yes.
Infertility management.
Well, look, I'm going to let you go now, but like I said, you've promised, haven't you, that I can have you.
Sure. I'll definitely come back.
And we can do
we'll share some new exciting things.
Yes, yeah,
Which
it'd be wonderful to talk about some, you know, and some of the things that you've pioneered as well. I'd love to ask you more about that in detail.
Yeah,
but for now, I'm just going to thank you so much, and yeah, thank goodness for brilliant humans like you.
Thank you. It was a pleasure, you know, talking to you. Thank you.
Thank you.